My name is Holly Harper, and I manage community benefits for the Sutter-Sac-Sierra region. And Sutter is a not-for-profit hospital system, and the Sac-Sierra region comprises Placer County, Sacramento, Yolo, Solano, Sutter, Yuba, and Amador. I say those and I have to count now because our region's fairly recently expanded, and so I still have to tick them off on my hand. We are here today to talk about collaboration. Dale is an expert at collaboration. He is a strong partner of Sutter's, and I am serving as his case study. So you're going to hear a lot of Dale with a lot of expertise talking about collaboration, and I will serve as his case study in one county within our region, Placer County. So with that, Dale.
Yes, thank you. I'm going to stand. I'm going to introduce myself, but I first want, let me introduce myself, then I have a few questions for you. I'm Dale Ainsworth. I am a managing partner with a firm that is based in Sacramento called Valley Vision. And we are a not-for-profit, a couple of you are nodding. That's good, right? That's good. We're a not-for-profit community development firm dedicated to improving quality of life for the communities in the Sacramento region. We call it the Capital Region. Very similar to the service area that Holly just described. And we have, for the last several years, had what I would say, a very outstanding partnership with Sutter. We do a lot of work for Sutter. We feel like the efforts of community benefit are very much aligned with our mission. So we're very pleased and very proud to do the work that we've done. Most of our work, if not all of our work, we work in a lot of different areas as an organization. We've done some work in transportation planning. We do a lot of work in the healthcare arena. We are doing a very large project in examining food deserts and how we can eliminate food deserts in the Sacramento area. Do some work in trying to advance technology, ensuring that everyone has access to technology if they want it, that it's not just served up on the more affluent communities in the Sacramento region. But most of our work is characterized by collaboration. Everything that we do involves multiple organizations, agencies, and institutions coming together and working collectively as one unit, if you would. Right? And we are an organization that facilitates that collaborative process. So we try to make it our business to know a lot about the topic. And so that's what I do. That's who I am. Several years ago, I worked in the for-profit world as a management and leadership position. I got really intrigued in how organizations run and moved into an internal consulting role. In the for-profit arena, went back to school, did some master's work in the area of organization development, and then several years ago really wanted to move into the social service, not-for-profit industry, and did, and in doing so began working at what I call the systems level. Not working with one organization per se to ensuring that it is most effective, but working with multiple organizations with similar missions doing the same thing to ensure the effectiveness of the collaborative, right? The systems level. And so I felt like I needed a little more education to do that, so I went back and just about a year and a half ago finished a PhD in organizational systems and my area of focus was working with multiple organizations so that they could function as a collective whole. And I'll talk about that a little bit more. So that's a little bit about me. What we want to do today is talk about what I think is a very ambiguous concept, and that is collaboration. It has multiple meanings in multiple settings. It's a multi-dimensional construct, as we say in the organizational sciences. It is, when I say collaborate or collaboration, for you it may mean one thing, for me it means yet another, and for someone else yet another. So we want to talk about this idea of collaboration. And we want to set it in the context of healthcare delivery, working with safety net providers, right? So I'm going to give you a kind of a grounding of our understanding of collaboration, what it means, how do you operationalize a construct or a concept such as collaboration? What does it look like when you do it? right? So I'm going to talk about that from a theoretical perspective. And then Holly is going to present a case where we've applied this. Our organization, we do a lot of research. We think we're pretty smart social science researchers, but all of our research is applied. It's for the intent of provoking or catalyzing action in some way. We call it action research. Some of you are probably familiar with the term. And so we're going to give you some of the results of our research and how we've applied it in an actual setting and what we got as a result. And so I'm going to do the background setting, and then Holly's going to talk about the case. The way that we were instructed to do the presentation was to present and then have Q&A from you. And I would like to alter that with the permission of the organizers just a little bit and allow you to ask questions as we present. Something we say may actually stimulate a question or you may need clarity around a concept. So I'd really like to ask you to feel comfortable. There's mics up here, they're recording the session, so if you have a question, grab a mic and ask away. You won't throw us off, I promise, okay? Can we have that agreement between presenter and audience? Thank you. I have the sense too that you're not going to be a shy group by any stretch of the imagination. So what we're going to do is give you our definition of collaboration. Again, it's a very difficult concept to clearly define. We're going to show you the ingredients based upon research, what the research says, what you need to have successful collaborations. Some of the challenges and obstacles to collaboration. These will resonate with you because those of you that function regularly in collaborative settings, these will be your lived experiences. Then we're going to talk about the case study. This is what Holly will, how we identified collaborative partners, how we assessed the degree of connection between the partners as a baseline, a place to start, how we evaluated the group's ability to collaborate, we call it collaborative capacity, or their skills to work in a collaborative setting. We know that they vary significantly. You know that they vary. Then interventions that we brought forth to increase the degree of collaboration among the group that we worked with, and then some of the outcomes. And we'll also share with you some of our missteps and some of the things that didn't work, I think in the spirit of true learning. All right, so that's the roadmap. So let me offer a couple of definitions. To collaborate is to work with others, right? That's a verb. Collaborate is a verb. But we also know that collaborative is an adjective, right? And it's a characterization. You say, oh, they're a very collaborative group. They're very, it was a very collaborative event, right? But we also have started using in the English language the word collaborative to denote a structure, a group, right? Some of you are nodding, you're familiar with this. Now you won't find this, your spell check will reject this usage of collaborative, but we use the term as a noun. We use the adjective as a noun, right? And this is my definition and what I'm going to offer for the rest of this session, and that is, a collaborative is a group of organizations, agencies, institutions, individuals, community groups, et cetera, that have agreed to work together to accomplish a jointly held goal. That's a fair enough definition, right? Now I'm going to argue, and I'm going to kind of take a scientific detour here as an organizational scientist, that collaboratives, the noun, become structures. You think of an organization, you think of your organization as a structure, as an entity, right? There's a lot of knowledge, a lot of understanding of what it means to operate and be part of a successful organization. And I'm going to make the argument and use the term collaborative to denote a superstructure, if you will, or a meta-structure that is formed when multiple organizations agree to work together. You follow me? It's like a big organization, or the Megatron of the Transformers. Those of you that have kids and have watched Transformers, how multiple Transformers form a big, giant, yeah, you know, okay, you have kids like I do, so watch Transformers extensively. And what we know is that these big metastructures, these collaborative structures, what we do know about them is that they operate differently than organizations. They're not the same. They have some similar characteristics, but also some unique characteristics. And I argue that if we want to understand how to be a part of and ensure that collaboratives are high-performing, that they accomplish their goals, we need to deepen our understanding of these structures, just as we have at the organizational level. How many of you have heard of the book Good to Great by Collins? And then you've probably read Good to Great in the nonprofit sector by Collins as well. Well, my argument is that there's no good to great around collaborations. When you go and try to find literature, try to deepen one's understanding of what it means to form a successful and high-performing collaborative, it's difficult to find. The research is out there, but it's not made it into the public domain. And so I think it's ironic that big, intractable problems, some of the most insurmountable problems that we face in our communities today, can only be addressed through collaborative action. Big problems like access to health care, what we'll talk about today, is an issue that's too large for any single organization to handle on its own. Government can't even decide what needs to be done. So access to health care requires multiple organizations to come together and form a collaborative so that we can address access to health care. And I think it's quite ironic that so little is known about those structures and what it requires to form effective, high-performing collaboratives. What the research does say, by the way, is that the vast majority of collaboratives that form fail to meet their objectives. They don't accomplish what they set out to accomplish. And I think as those of us who are working in our communities to try to improve them, we need to better understand what it means to form a successful collaborative, right? I think that's all I'm going to say about that. That's my speech about the importance of collaboratives. We form these things because we realize deep within us, at some level, that working together and collectively, we can accomplish something that we cannot accomplish working as individuals. And the research shows that we, as individuals working toward goals, we derive more enjoyment working collectively than we do working alone. Most of us, not all of us, most of us. So we really like working in groups. And so the promise of collaboration is that we'll be able to accomplish something we all want to see accomplished, but we know that it's beyond our individual capacity or beyond the capacity of our individual organizations. So we form these things, right? We're going to make a difference. We're going to make the changes that we want to see. This is a summation of some of the research that is out there that details the success ingredients, right? The core ingredients that have to be present in our collaborative structures for them to be successful, right? You don't have to write this down. I'm going to talk about it a little bit more. I'm trying to demonstrate to you that the model that I'm about to introduce is a research-based model. You can if you want to, or I'll send you the citations. I'd be happy to, so that you can see. But you see the columns running. You see that the top of them, those are citations of different studies. And from those studies, I've pulled out these key core ingredients, the list you see on the column to the far left, right? And so when you look at the determinants of success at the organizational level, you know that successful organizations have missions, they have visions, they have good leadership, they have structure, they have technology, et cetera, et cetera, et cetera. We know this about successful collaboratives, the noun, is that when we find successful collaboratives, we see these components or ingredients present and developed to some degree, And I would argue that collaboratives frequently function with a portion of these, not all of them, whereas some are highly developed within the collaborative, some are very undeveloped or not even present in the collaborative, right? No organization functions without some degree of dysfunction, right? Most of us are most familiar with the dysfunctions of our own organizations, right? I can tell you all about ours when we're done with the presentation. And I would say that most collaboratives have some level of dysfunction in them. And I argue that you can tie the dysfunction that you find in a lot of collaboratives to one or more of these core ingredients not being developed, not being present, or being mal-developed, if you will, right? So let me talk about each of these in a different way. This is the way I'm going to present this. That's made to look like a block, like a brick wall. Did it work? Does it sort of? Yeah. Built on a foundation of trust and readiness. Okay, good, good, good. So let me back up and talk about some of these just at a very high level. And again, these will resonate with you because hopefully this is part of your lived experience. Each collaborative has to have some development of group process skills within the collaborative. I'm talking about norms, conflict resolution, governance structures, et cetera, right? My experience in working with collaboratives is that these are frequently left to develop on their own, right? Outside of consciousness, these things just kind of happen. And I argue, and I think the research supports this, that the more deliberate you are about developing conflict resolution practices, you're more conscious about norms that develop early in the life of the collaborative, governance structures, decision-making models, et cetera, the more effective your collaborative will be, right? Collaboratives cannot live without information, so they need good information distribution systems. I've seen these be as formal as technology-based information distribution systems, websites where all members can go and be a part of and get on and learn and understand. I've seen them be as informal as listservs, blackboards, chalkboards with information on them, but in each collaborative, a core ingredient is the ability for members to have access, all members to have access to the same information as every other member. Now in organizations, think about this for a second, organizations, knowledge and information is usually compartmentalized, usually more held at the top. Information is actually a form of power and a way we distribute power in organizations. And as you go down through the hierarchy of the organization, there's less information available. Collaboratives don't function that way. They can't. They have to be organizations that have an equal distribution of power where everyone has the same access to the same information at all times. You can have, but you don't have successful collaboratives when you impose hierarchical structures on them, right? Does that make sense to you? So you have to have this information distribution system so everyone can know what everybody else knows at the same time, right? To keep power equally distributed. You have to have the right stakeholders, and as importantly, you can't have the wrong stakeholders, right? And everybody's nodding because we've all been a part of collaboratives that had the wrong stakeholders. Right stakeholders meaning you have representation, and you have to have fair and adequate, equally distributed representation. And again, there are collaboratives that frequently have the wrong stakeholders. Either you have a person and their particular characteristics and behaviors are a detriment to the collaborative, or you have an organization that you feel like you need to have represented in some way, but they have nothing to offer, nothing to add, right? They're just kind of a face in the room, right? So the right stakeholders. A leadership and administrative function. I argue, our organization argues that you really need a facilitator to ensure that collaborations succeed. In many settings that I work in, collaboration is kind of the leftovers in terms of the energy of the organization, the focus of the organization. When they have time, when they can squeeze it in, they'll attend the meeting, they'll have some level of participation. And collaboration is kind of what happens after you do your real job in your organization, right? And that has the characteristics of a volunteer organization, right? And so you won't have this focus on efficiency and function. And so a leadership function and an administrative function, a facilitative function, can really keep things moving, right? And it's a very important ingredient as well. Client centrism, the collaboration has to see itself and function through the eyes of its client, not the eyes of the collaboration itself. And I'll talk about a little bit more about that in a bit. Shared goals and feedback mechanisms. I put this on the top because I think this is probably the most important. If I had to prioritize a key ingredient, is collaboratives tend to, you'll see a relationship in research, the research we've done, we see this relationship constantly. and that is the clearer the goal, the more articulated the goal is, the more likely the collaborative is to reach it. It's a pretty easy concept to get. If you know where you're going, you're more likely to get there, right? If you know where you're going. And the Sacramento Coalition to End Childhood Obesity, right? It's a collaborative that exists to what? End childhood obesity. But that's a big, right? So what does it mean? How exactly are we going to end childhood obesity? The more clarity you can get around these particular goals, the more effective collaboration tends to be. And then access to resources. This is, you got to have access to social capital, political capital, economic means, et cetera, et cetera. So the core ingredients of collaboration. All built on a foundation of trust. Yes, ma'am?
I'm pretty loud. Oh, okay. I'm still really loud. Okay.
For the recording.
Where do you start? Am I gonna, do we get together the first time because we have a common interest, so we're forming that goal, or do we make sure we get the right stakeholders in the room before? I mean, where do I start?
That's a really good question that I think I could answer now, but I think we'll address it when Holly presents the case of how we started. But I think it's an important question. And if we don't answer it when we present the case, ask it again, and we'll talk about it some more, okay? All right? Any other questions? This is a good point. Yes, ma'am. Oh, Mike. Sorry.
I hope it's appropriate to ask a couple of questions at this juncture, and if not, we can put them until the end. So my first question is, can you change a wrong stakeholder to a right stakeholder? Is there a process by which you function in a collaborative that you can make a change?
Yeah.
And then the second question is, when you are invited to be part of a collaborative and they start with a statement that you have to leave your organizational interest at the door, are you no longer in a collaborative?
Yeah, those are two really good questions. So I'll talk about the first. Can you displace a wrong stakeholder or replace a wrong stakeholder with a right stakeholder?
Change
stakeholders? Yes, you can. I'm assuming that you're asking in the context that the stakeholder isn't voluntarily willing to be displaced, right? That maybe you have someone in the group that shouldn't be there, right? Disruptive, yeah. Yeah, I think you can. I think you actually, I think you have to. I think you absolutely have to. But I think this is the importance of an active leadership function in collaborations and an active facilitative function. When we lead collaborations, we spend more energy working down here than we do up here, if you follow me. So we deal with these types of situations all of the time. You think about your role in organizations, how much energy you spend on working on this stuff that goes on down here in an organization, which is actually more, you know what I mean when I say, it's actually more powerful than the stuff that goes on up here, right? And the collaboratives are not immune from those dynamics. And so I think that leadership has to be facilitative enough to deal with stakeholder issues when they arise. Otherwise, you're going to run off the tracks. It's a derailer. It is a derailer. And just as leaders in organizations are charged with ensuring that organizational members contribute and don't diminish the effectiveness of the organization, I think the leadership and facilitative function and collaborations have the same duty. And it's hard to do because these are volunteer, you can't fire someone you can't give them a performance evaluation, right? Collaborators aren't quite that formalized. It's hard to do. So I think it takes a lot of backroom work, or what Chris Huxham, who is a famous theorist that has worked in this area for years, she calls it collaborative thuggery. You just got to get in there and do the work to make the thing succeed. But what keeps this clean is a goal. If you know where you're going, you know what is impeding your progress toward that goal, and you know what you need to get there. And so when you have a disruptive member and you have a goal in sight, it gets a lot easier to say, you're not contributing to our journey here. We're going to ask you to leave. But it's not an easy task, just as dealing with performance issues in organizations are quite difficult. There's nothing more difficult that I know that you deal with. Question 2 was, when you walk into a room, a collaborative meeting, and the statement is made, we want you to leave your organizational interest at the door, are you no longer a collaborative? Right? And my response is, you can't expect that of members. It's just not reasonable. You can't, the reason that that you would join a collaborative is that it helps you advance the mission of your organization as well. So you have to balance. You can't focus too much energy on your organization's interest at the expense of the collaboration and vice versa. You have to be balanced. But organizations show up and participate in these because there's something in it for them. And there has to be the WIFM, what's in it for me, present in any collaboration. So whoever says that, you have them call me and let me chat with them. Yes, ma'am. Oh, thank you for the mic. Are we okay?
Does this collaborative structure process work with groups and organizations of all sizes? For example, or might this be addressed in your case study? For example, will it work with the small grassroots organization who wants to be in collaboration with the big hospital administration piece? I mean, does it all kind of work, or is it better with two similarly kind of functioning structures to work better together and collaborative, that kind of thing?
Yeah, that's a very good question. And my experience and my belief is that in any collaborative situation, you'll find some elements of these structures present. These are basically coordinating mechanisms for groups. Groups can't work in a coordinated fashion without these structures in place to some degree. What struck me about your question is small grassroots, out in the community, big organization over here, and those dynamics really are worth being attentive to. In collaborations, there has to be the sense that everyone's equal. And one of the predominant things that disrupts this idea of equilibrium is money, affluence, right? Money is affluence, is influence and affluence, and it really can throw things off. And that's where I think a facilitative function can minimize, never get rid of it, can minimize those pejorative effects that you see. That's a really good question. Okay. We have this promise of collaboration, but we also have this challenge, right? We get stuck in politics, competition for funding, vague goals, limited resources, and we fall into what is referred to in the literature as collaborative inertia. Nothing happens, right? Couple of quotes just to let you know what you're up against. These are a couple of theorists that have written extensively on the topic of collaboration. I like the one at the top here. It says, trying to build an interorganizational network or a collaboration, a collaborative a noun, is like a polyglot crew of laborers constructing a house out of misshapen, fragile, and costly lumber on a muddy hillside swept by periodic storms. That's exciting, right? That's the good news of the conference, right? It's like it's difficult, and your lived experiences probably affirm this. You've been a part of or tried to join or tried to create these things. They're difficult structures to get going, and they're fragile beyond imagination. They fall apart easily, right? They take a lot of nursing and a lot of love, right? And then Barbara Gray, who is University of Pennsylvania, who has published extensively in this area, says just having a good idea, just agree, hey, we're gonna form a collaborative, doesn't do it. Right? Simply agreeing to work together doesn't ensure success, doesn't automatically ensure success. The agreeing is the fun part, isn't it? When we get together and we're excited, we're going to work together, that's fun. We get all excited and juiced up about that. Then when we hit the road and start living the collaborative experience, we start having these types of experiences, right? They're challenging. Should you collaborate? So Chris Huxham, again, a noted theorist who writes extensively, she says that it's so difficult forming effective collaborations. Now I'm talking about collaborations that accomplish their goals, not collaborations that meet monthly, right? And you know what I'm saying, right? You go to those monthly meetings too, don't you? Right? I'm talking about collaborations that meet their goals, that do something, the things you want to see done. It's why you're in the jobs that you're in, right? Chris Huxham says, these are structures you should only form if you have no other alternative. It's exciting at the outside. It's fun to say we're going to work collaboratively, but it's so difficult that you should only do it if you have to. Right? I think that's a pretty sobering quote. If you can do it in another way, is what she argues, find another way. You have a better chance of success to accomplish it at the organizational level, right? Or through some other means. This is my 2 cents on that. Do it only if you have to or you need to, right? If there is a goal, if there is something that needs to be accomplished and you can find no other way other than attacking it through a collaborative means, a collaborative structure, then go for it, right? This is my top 10 list. I think this is the last slide. I know you're ready to get into the case to see how this looks in real life, or our experience in real life. My top 10 list, I think this is what Dave Letterman used to do. Top 10? Yeah. Top 10 reasons collaboratives fail to meet their goals and objectives. This is just kind of the flip of what you saw in the brick wall slide. Existing for the sake of existing, no clear goals, no mandate, no access to meaningful, useful data and information, going at it blind, just kind of muddling your way through. Limited resources. This is one I'm sure you're familiar with. Conflict, hidden agendas, mistrust, misalignment between members. No active leadership or ineffective leadership, no facilitative function, no secretary, no administrator of the collaborative, having the wrong members, not having the right members, having too formidable a task, right? So one that's bigger than the collaborative, or having a weak collaborative to tackle a very formidable task, and then of course the absence of clear and compelling goals.
So I'm going to try to stand over here and so I can see everybody. So again, Dale's the academic person in this. I'm the doer, the mixer. I don't use words like polyglot. So I'm going to talk at a little different level, and using Placer County. I get out there, I meet the people, and we make things happen. But we do so because we have partnerships like we do with Valley Vision and Dale, people that can back up our gut instincts with the science. So Placer County is unique. In a minute here, we're going to show you where it is on a map. It's between the Sierra Nevadas and Sacramento, and it's incredibly affluent. It's a very, very affluent county, which makes it unique. It's also got a huge senior population. I know somebody said they were dealing with senior issues. Very large senior population, about 330,000 people. About 50,000 of those are underinsured. So because they're an affluent county, they often get ignored for pockets of need. And I see nodding heads, and that happens a lot. In our community health needs assessment, we don't like to compare Placer County against the other counties because it looks too good. It's too good. So it's important to recognize that there are those pockets of need in the affluent counties, and I think this room truly gets that. Placer's orange. There it is.
There we go.
Again, another representation of Placer. Those are all the zip codes, a handful of zip codes within the county. And again, 330 is about the population, 50,000 underinsured, the uninsured and Medi-Cal. If you compare that against maybe just one zip code in Sacramento, another part of my region, 95826, I think would have closer to like 32% uninsured. So 15% is about the average here. Not so bad, but still, pockets of need. So here is our, go ahead and click one down. Here is our case study. Placer County, we started having these conversations about a year ago, and we wanted to get together and talk about the health, the connectedness, the effectiveness of our safety net system. We wanted to define safety net system. We just started doing things like that. So we brought together a group, Kaiser Permanente, Sutter Health, and the Placer Collaborative Network. The Placer Collaborative Network is the local collaborative arm. They convene CBOs, the not-for-profits, small businesses, and pull together, talk about issues that exist, and address them collaboratively. Healthcare in the safety net system happens to be a big one, and everyone was very excited. I'm just one member of the collaborative, but everyone was very excited to address this issue. So we talked about how do we figure out how healthy, how effective our safety net system is. So before we convened people We had to figure out who was there. Like I said, I get out there, I'm the doer, I'm the person, but I didn't even know how many people exist in Placer County, how many people could potentially be members of that safety net system. Once we identified those, there were about there were 77. There were about 80 organizations, and that was astronomical to me. I would deal with a lot of organizations, and I had no idea. So those 77 people were asked to take a survey to address their knowledge of who existed in the county. So I'm the local nomadic shelter. I'm the gathering in there. And I was asked to assess how well I knew and worked with the Family Resource Center, the Lighthouse, on a scale of I don't know them, never heard of them, who are they, to I know them, I work well with them, I work with them all the time. And so they were asked to address those things before we met. Then we met. Very excited, engaged group. Everyone was very eager, again, to collaborate. It's an environment in Placer that fosters that as well. But they were excited to learn more, to learn that you exist in the room and you exist in the room, talk to each other, names with the faces, a very engaged group. At that group, we learned about who were primary providers, who were secondary providers, who were members of the safety net system that never considered themselves that, because we defined it there, and I'll define it for you here in a minute. Between that meeting and the next one, they were asked to take, it's not a survey, it was a assessment of what they considered themselves, primary, secondary, not a member at all, and how they felt about how Placer County was operating. Is there leadership? Do you feel good about the communication? All of that good stuff. And that is where we, well, almost are today. The results of that assessment showed that communication was lacking. We had a lot of good communication going on, a lot of people understood each other, and again, maybe a little better than other counties, in fact, a lot better because the county is involved. But we learned that communication could be improved, and maybe it was the first step in improving that safety net system. So luckily, there we have what is called the Network of Care. Has anybody heard of the Network of Care? It is actually a national database. It's a national database that some counties, cities latch onto and some don't. It exists everywhere. It's a matter of having some funding and having somebody to operate it. It exists. Placer loves it, but it's underfunded. It was undermanned. It wasn't up to date, and it's unknown. So this group has decided that the next natural step to improve communication, the first goal, is to use that Network of Care more. So at this point, they've got an AmeriCorps person in there to update the site. We're going to use that collaborative, that group, to communicate that the site exists again, hold a big launch in April, to talk about how good the site is, that it's up to date now, it's something you should utilize. But the best part about it is everyone that really needs to use that site is in the room, and they can communicate that out to everyone else, and they can use it themselves. So the people that really need to be using that, we're already in the room. It's a group we can pull from. Yeah, sorry, the mic.
Could you just say a little bit more about this national database?
The Network of Care?
Yeah, the Network of Care. And then could you just also one more time say why is it that Placer County was so very excited about this particular system?
You know, I think it was just a subject we could all rally around. Everybody in that collaborative had something, or most people in that collaborative had something to benefit from improving that safety net system. If it was a Family Resource Center who gets funded by providing referrals to various organizations to improve health insurance enrollment, to improve enrollment, or to transfer them to housing specialists if they need that, they had a benefit in figuring out how we could do this better, how we could work together better. What Dale said earlier is funding's down. It's a different environment. And the more people work together, the more we can spread out that funding. So I think that was the general level of excitement in the room. And then the Network of Care is a national, you know, I'm not even sure, I think it's an independent organization who runs it. And they're everywhere. You just have to log on to the networkofcare.com, and it's up to somebody to grab the reins and say, we're going to update that locally. We're going to encourage that communication and spread that. We have it in Placer. It's somewhat utilized, but it's known enough to not want to recreate something, but it's not used enough to make the system where we want it to be. Does that make sense? Okay. Next slide. So this is just another visual of the safety net system. Oh, all my nice arrows. The direct provider is what most people consider the safety net system to be. The FQHCs, the federally qualified health centers, the community clinics, the emergency departments, the hospitals. That's not all there is. The secondary providers, as we see it, as we define it, and as we asked the collaborative to help us define, are the family resource centers, are transportation providers, does everyone know the word promotora? Okay, are the promotoras, a promotora, for those of you who don't know, is essentially a case manager who can provide culturally relevant, linguistically sensitive information to Spanish-speaking clients who need to access a system that's difficult to navigate. So those are the secondary providers, and they're equally as important as the primary providers. Without the family resource centers that can help enroll people in insurance and refer people to the right spots, we can't do business correctly. Okay. So this is a map that reinforces what we've said. These, all the little dots, if you can see them, represent safety net, parts of the safety net system. What's really important in this slide, though, is the inset. So the darker the color, the more vulnerable the population. So there's Placer, but the lighter needs here, the darker the color, the more vulnerable they are. And so that big red something at the end is Lincoln. Lincoln has 1 or 2 dots on the map. Lincoln is underrepresented. So improving the communications there is one step, and obviously Lincoln needs some more providers. We understand that, we recognize that they need some more help. They have a family resource center there and I think a clinic, but that's all they have. So knowing that makes it even more important that we communicate and refer more appropriately and at least use the resources that exist today. Here's the survey. This is the initial survey. So every one of those 77 organizations is represented on this survey. The Abundant Life Church is the first one listed there. And they were asked, that Abundant Life Church, in their own survey, to go through and say, I don't know the Lighthouse. I've never heard of them. I've heard of them, but I've not worked with them. I've worked with them once or twice. I regularly work with her. I know very well, and I work with them often. And I think this next slide is the result of this survey.
Yeah.
Dale. And Dale's going to describe the dots because they kill me. And it's easier for somebody else to explain.
This is not like SPSS software.
Absolutely not.
This is just a PowerPoint that we used to feed back the results of the connectedness survey to the group. And you can see the 5-point scale that the survey, or the connectedness survey was built on. 1 being, I don't know this organization, never worked with them, never heard of them. 5 being, I know this organization, I work with them regularly. Each of those dots, irrespective of color, represents one of the 77 organizations that was in the previous slide survey. And each dot represents that one organization's mean or average score, right? And so the color is just to show some distinction between this great-looking color group on the left. These are a number of organizations that most people indicated that they had never heard of. They had heard of them, but had no idea what it was like to work with them. That yellow group indicates a cluster of organizations that people had heard of, worked with maybe once or twice, and then the red indicates the organizations that people frequently interacted with. Right?
And I think the red, the people that fall within the 3 area were mostly county people, which makes sense because those county people know and work with almost everybody in there. So
I think the point that I would add here is a pretty sobering, when we fed this back to the 77 organizations, it was a pretty sobering, especially some of those organizations that said, wow, am I a blue dot? You know, am I out here working in isolation? I feel like I'm working collaboratively, but nobody knows about me. So it's really a kind of a baseline analysis of the measure of connectedness.
Thanks, Dale.
Sorry, Holly.
But I think I'd venture a guess that if we did this in another county, that it would look a lot worse. So we were proud of this, but obviously there's room for improvement. Next slide.
Okay.
So this is the other assessment we were talking about. People were asked to assess primary, secondary, or outlier, and questions like this were asked. We have the metrics we need to measure the levels of access to healthcare and related services in Placer County. Rate that from strongly agree to strongly disagree. And that's how we came up with the most agreement around the fact that we needed improved communication. The thing that was next, people didn't understand what leadership was there, who was actually taking that leadership role. That's something we may address at some point, but communication is what we're starting with. So this is the survey that got us to that.
I'm going to go to the bar graph, because all the dots don't make sense.
All the dots don't make sense. I agree. Those dots don't make sense.
No, they do, but I think they're not necessary.
But I think somebody in the room asked before, just before you start the bar graph, how do you start a collaborative? And I think the important part of starting it is in our case study, and I'm not sure who asked that. Was it you? How do you start a collaborative? Well, I think the very first step was defining who exists in the system before you even ask people to come together. That assessment of who exists there took a couple of months. Took a couple of months to figure out everybody there.
Yeah. And this is the results of the assessment where we simply measured, if you remember the brick wall model I showed you, 7 dimensions, 7 core ingredients. This is simply an assessment we used to measure the level of development of each of those core ingredients through the survey that Holly described. We just asked people, do you have an active leadership function? Do you have a communications infrastructure? And this is the aggregation of the scores. And so you can see this top bar, back to your question, was or using a scale 1 to 5, 1 being not developed, 5 being highly developed. This top bar, this communications infrastructure, was the area in which most respondents, members of the safety net system, said, we have an underdeveloped safety net, underdeveloped communications infrastructure. We don't have access to information. We don't know who else is out there. We don't have a good directory, et cetera, et cetera. And so one of the first steps in intervening toward improving the collaborative skills of the group was to get this communications infrastructure updated and deployed in the county, which is the network of care. It's what they chose they wanted to use.
How did you determine what 77 organizations to put in to start asking the questions?
Mm-hmm. Those were, we used the model where we found direct providers, secondary providers. We did we just basically went and found people that we could find online, directories, et cetera, then called them. We used what we call snowballing techniques, called them and said, are you still active? Yes. Do you know anybody else that's doing what you're doing? Yes, you should call this organization.
It's pretty low tech.
Process that she took. Yeah, it is. It's staggering. If you may know this, it's staggering how unfindable many very good organizations are that are delivering social services. And so finding them was quite an undertaking, but that's how we did it. Just get on the phone and the internet and the car and drive around and look.
Okay. Let's just
talk about that
because we already talked about this. The collaboratives like this have limitations. 2 would be the fact that it's very difficult to measure what doesn't happen. We can't know who's being referred better and not visiting our emergency department. But what we can measure, of course, is the number of referrals at a family resource center and maybe the reduced level 1s and 2s, the non-emergent visits in our emergency departments. Maybe we can measure things like that. So the limitations are there. A lot of it is subjective evidence, but there are some measurable objective data points that we can look at. Another huge part of the problem, I think, with collaboratives like we did this in Sacramento a year and a half ago. And we did a similar thing, maybe not quite as many groups, not many people are as engaged as they were in this county. It's a smaller county. But they were all very energetic in the room as well. People want to collaborate. They have a passion for doing this and rallying around for the reasons we discussed. Resources are limited. And they want to do their jobs better. But what happened in Sacramento is we jumped to, okay, we need that data, we need that directory, we need that referral source, we need some sort of a tool. Let's get a tool. We're going to do this active, online, exciting website that is going to help refer. We're going to put all the players on it, and then our emergency departments are going to use it, and you're going to use it over at the effort, our local federally qualified health center, and it's going to be awesome. And it is. But we don't use it enough because there aren't enough people on it yet, and we didn't have all the players in the room. It is an incredible tool. It is. And we will use it at some point, most likely, but it was preemptive. It was way too early we just jumped ahead. And what we needed to do is slow down and do it the way we did in Placer County, which is why we're using that as a case study and not Sacramento. So some limitations.
So which leads me to a next question. Do you find that these kind of processes work easier in smaller counties or municipalities than urban cities that already have layers and layers of structures and collaborations already in place?
I think what we found is so far is yes. It depends how functional that system is. Not necessarily the size of it, but how functional and how well people already work together, how open people are to changing that. And I think that's becoming more common, where people are becoming more open to that collaboration because it's becoming crucial. There isn't a lot of choice anymore. Like Dale said, collaborate when you have to or you need to. We have to right now. So maybe not the size, but the openness to collaboration.
And I want to add to, I think it is much easier when you can easily define a community, right? I think that's what you were getting at to a degree, and Placer County represented kind of an autonomous, isolated community, much easier to work in than a large rural area where it's really a tangled web of multiple communities overlapping and interacting with one another. Yeah, I think it's much easier, which is why we used it for the case study.
I'm just a little unclear. Did you articulate a goal? Was the goal to establish a collaborative, or was the goal to have more resources available to those who were uninsured or underinsured?
The goal was truly to improve the effectiveness and connectedness of the safety net system. Measurement tools for that weren't necessarily clearly defined, but they exist for things like I said, reduced emergency department visits when they're unnecessary. Things like that can open the, give us a measurable objective, but the goal was truly, I guess it is subjective, to improve. So.
Yeah, the collaborative skills.
It wasn't to form another collaborative, that already exists there. So, we ask our partners to collaborate all the time. We ask the local not-for-profits, the faith-based organizations, everybody to collaborate. But oftentimes, hospital systems, healthcare systems are criticized for not doing it together. And it's somewhat of a myth, but it's somewhat true. We're getting better. But in the Sac Sierra region, specifically in Sacramento County, I completely disagree. We do it incredibly well. And we do that, we work together, who knew? We work together because we're friends. We all have personal relationships. I talked with the community benefit manager for North Sac Kaiser on the way up here. They're personal relationships. We bounce things off each other. I'll call someone to do just a gut check to avoid duplication and ensure collaboration. And we're doing that better and better. And I think in Sacramento, we can be incredibly proud of the way we do it because we have those relationships with all of those community benefit managers. Somebody said, let the CEOs compete, we collaborate. Although I have to say our CEOs encourage and foster that collaboration from the top down. We ask our partners to do it, so shouldn't we? We've even talked about collaborative funding. We haven't ventured into that yet, but a guess says we'll get there soon. And we'll get there with a shared common goal to achieve something and have metrics that we all want to see achieved. We can have a greater impact working together, and it's not just fashionable right now, it is becoming crucial. We have to pool money, we have to share knowledge and stop reinventing the wheel. And we just have a highly collaborative environment. Like I said, we recently expanded our region to include Solano and some other areas, and it's new there, but we're doing it. We're already working with Kaiser and North Bay and the other healthcare systems and the county and the collaborative there. It works well. Some examples of that, we actually brought a handful of copies of our community benefit report, not 50, because we're very protective over them and we try to keep them online, but there should be mostly enough. And the community benefit report is a result of our community health needs assessment. What was once the community needs assessment is now the community health needs assessment. It's a result of that, and there are a lot of programs highlighted in there that all the hospital systems collaborate on. An example of a 4-hospital system collaboration. So in Sacramento, there's CHW, there's UCD, there's Kaiser, and there's Sutter. We all collaborate on the interim care program and have for 7 or 8 years. The interim care program is a hospital admission program where people who are admitted into the hospital, patients of any of our hospitals who don't have another place to go, homeless, are discharged or connected with the local FQHC, the effort up there, and are connected with a case manager there, and are discharged into the interim care program, which is in collaboration with the Salvation Army, who has an 18-bed shelter there, and where those clients are wrapped with services, case managed, housing, insurance enrollment, substance abuse treatment, treating the whole person, connected with those resources, and hopefully not discharged back out onto the streets. We have a very good success rate. So all 4 hospital systems participate in that, fund it, and meet regularly to ensure success. And we've seen 700 patients in there, and it's like 80% are returned to some form of housing. We've also mimicked that program in Placer County and Solano because it's been so successful. All collaborations with all of the hospitals in every county. The community health needs assessment is on the next slide. Just a picture of our CHNA is the healthy living map. You can view it more. I don't think we have the internet available here, but it's at healthylivingmap.com. You see all our 4 logos listed on the bottom. We spend about 2 years getting this CHNA, new acronyms throwing me off, getting the needs assessment together. We agree on what the goals are, and then we work with Valley Vision, the geniuses behind the living map, to go out and truly conduct those assessments in the counties we all serve. And then we write our community benefit plan and community benefit reports based on that. So that is our case study.
Questions?
You both have talked about the value of facilitation within the collaboration. You talk about how you handle the funding for something like that. Does everybody come to the table with some money? The assessment and everything sounds like a pretty involved, I think, expensive project. So can you kind of lay that expectation out for us?
Mm-hmm. Mm-hmm.
The needs assessment is funded by the 4 hospital systems. Pure and simple. It's something we're required to do. We choose to do it better than required. This is a very interactive tool, and if I had internet access, I would show you how interactive it is. So this hospital systems fund that. The PATH, the Placer Access to Healthcare, was funded by Kaiser and Sutter, but mostly because the other organizations in there don't have that type of funding. And that process, that collaborative, wasn't that expensive. We held a couple of meetings. We horned in on the Placer Collaborative Network meeting, and it was fairly affordable. It was all done surveys over email.
And if I could add to that, Tracy, some of the other ways that we have participated in other collabs as facilitators is we've had some funders come to us and say, hey, we really need to address this issue. We'll fund you if you'll go through this process, identify stakeholders, engage, bring together, facilitate joint and collective action, and we've been funded that way. We've had other instances where we've had several individuals, organizations come together and say, we need to do this. Let's all go develop some funding and work collaboratively. So we've participated in fundraising for a specific initiative, along with others. And then we've had instances where Sutter has come and said, we need to do this in Placer County, we'll fund you to go do this type of work. So it's a lot of different ways. Yes, ma'am.
Somehow this is wrong to have the mic and ask a question. So oftentimes it's a larger organization that has the money to support the logistics and facilitation. So what are some ways to avoid kind of a subtle influence, because there could be a power differential there already from resources, if the facilitator comes from a larger organization?
My belief and our approach is that is that minimizing that, I don't think you ever get rid of it, it's my belief, but minimizing it, I think, becomes an issue of familiarity and trust.
And solid facilitation.
With the facilitator. Our organization, we are almost to an extreme on neutrality. You won't see us take a position on any political issue. I can't put a Obama bumper sticker on my car if I want to, et cetera, because we're very diligent about saying we're here to ensure the collaborative success, whatever outcome the collaborative wants to undertake. But I think that, I know we're 17 years in Sacramento, and we had to earn that. And we don't always, it doesn't always work. The money does mess with the power distribution in the collaborative. It does. I think minimizing it is the best you can do. But it's a good question. It's a really good question.
Okay, now I'll share.
Okay.
Thanks. Could you talk a little bit about the life cycle of the collaborative? So at the beginning, how important is it that there's, okay, up to now we were doing needs assessment and planning and informal, and today is the day that our collaborative starts. And then also how to think about sunsetting. Is that at every meeting say, should we keep going, or do we check in after a year?
Great question. Great question. Our approach is if we're starting from scratch, developing the collaborative, there's always two things going on when we convene the group. There's the work the collaborative is trying to do, right? So let's work to do this. But we're also focused, while we're doing that work, on developing the skills that ensure collaborative success. So we have a model. We're very upfront. We start dealing with governance, developing governance structures, decision-making models, conflict resolution practices and processes, et cetera, goals, goal clarity, mission vision, et cetera, et cetera. And while we're doing that, we're also developing an exit strategy of, we think we'll do this for 2 years or 3 years, et cetera, et cetera. So we're doing the work of the collaboration while doing, it's OD work, organization development work at the collaborative level. So we always are doing those things together, mindful of an end zone. Every project we start, we have an end zone in mind. So I believe that it is appropriate to dismantle a collaboration once it reaches its goals. It's not a popular view. Once you get these things going and you're comfortable operating them, people want to keep them going. It's like, all right, we accomplished this goal, let's go find another goal and use this structure to accomplish it. And I think that that's appropriate sometimes, but I think you see a lot of collaboratives that have done what they were set out to do and should sunset or transition or dismantle, et cetera, and folks don't want to do it. But I think you have to think about that going in. I think it has to be a part of your plan going in. So I think that there's no organization that has been in existence forever. Organizations have a life cycle just like humans. They all grow and they all come to an end, and I think collaboratives have the same way, and I think it's a good question. You have to be mindful of that cycle.
We have 3 more minutes and one more question.
Okay, how many more minutes?
3.
Okay.
Wow, good for us.
I have a question. My interest, since I work for the county hospital and one of them in the Bay Area, is we're trying to build a collaborative that includes patients, community, and as well organizations. So do you have any examples of that type of engagement? Because you're dealing with a really different cultures organizationally, not only ethnic, that are successful, because that's the challenge, is getting patient input, keeping them engaged. So do you have any examples of that type of work with the hospital system? Because the hospital system is so different just in itself.
Yeah, I think that I can think of examples of bringing this very disparate group together, and it is a significant challenge when you have different worldviews. This is one of the challenges of keeping collaboratives moving. You have very different worldviews, paradigms, ways of thinking about how things should operate come together. We typically bring our personal, cultural, organizational experiences into collaboratives and think they should operate the way we think that they should work. And bringing these together, bringing all these disparate groups together and asking them to work cooperatively is a significant challenge. And not only that, you have different levels of sophistication around something simple as meeting management and meeting participation. Where you have some people who, like us, we're used to going to meetings, we know how to participate and how to be a good meeting member. And you have, we work with community groups that don't know what to do in meetings and just don't know how to participate and contribute. It's quite a challenge. I mean, it's quite a challenge. And I think that there are many examples of it being successful. I think there are as many examples of it not being successful, to be honest with you. But it is a challenge. And I think this, again, is the importance of facilitation. Someone whose focus isn't on the work of the collaborative, but the functionality of the collaborative, who can go do the type of work to keep those meetings, those groups, kind of bring everybody together and get everybody on the same page. I think we have just time for one more question. Does somebody? 10?
We have one more minute.
Okay.
I was lucky enough recently to participate in a quality improvement college from the Breakthrough series. It's the Institute of Health Improvement, and they had a 3-day college that gave a lot of detail on, and a lot of it was focused on collaboratives. Oh. It's an expensive college, but if you can get health institutes to work together to get folks to go through that, I think they could give a lot of the tools that would help to do kind of the things that you're doing.
That's a good point. That's a good point. I want you to tell me about that before we get out of here. I've enjoyed presenting to you. You've been wonderful. I've enjoyed the interaction, and I really appreciate the ability to come and present with a wonderful partner like Sutter Health, so thank you.
Thank you.